So now let's talk about another type of heavy chain disorder, which is a subtype of the plasma cell dyscrasias, the alpha heavy chain disease. The term alpha basically signifies that there is, in contrast to the IgG antibodies, which we found out in the gamma heavy chain disease, the alpha denotes the IgA antibody. So the IgA antibodies are generally in excess, or the IgA heavy chain is the one in excess in alpha heavy chain disease. It is also denoted by the term Seligmann's disease. The IgA antibody, as you know, is basically present in the epithelium, in the respiratory and the intestinal epithelium. It can help in absorption. It provides humoral immunity against the foreign invading antigens. It helps us clearing mucus in the respiratory system. So if we have a problem with the alpha heavy chain, we might have certain respiratory problems and certain malabsorption problems. So these are the major clinical features. The patient with the Seligmann's disease presents with a chronic diarrhea, which signifies the importance of the IgA for absorption in the small intestine. In the absence or in the disorder of this IgA chain, the patient will have chronic diarrhea, which shows a malabsorption disorder. Along with that, because of that diarrhea and malabsorption, the patients might present with a weight loss. The weight loss can also be attributed in part to the anemia, the normocytic normochromic anemia, which is present in all the types of plasma cell disorders, because it is a type of a clonal malignancy. So the patients will have an anemic picture. Along with that, the diarrhea and these two compound to leading to the weight loss. Various types of malabsorption syndromes can present in conjunction with the chronic diarrhea, and this also shows us the IgA importance in malabsorption. Along with that, the IgA presentations in the respiratory tree can lead to various types of infections as well. And finally, we have the adenopathy or the lymphoid enlargement, specifically of the mesenteric and the para-aortic lymph nodes. So this is also related to the digestion of the part. So basically this disorder, if you want to remember, the alpha HCD, also termed as the Seligmann's disease, is generally a disorder related to the GI tract with chronic diarrhea, malabsorption leading to the weight loss, along with the mesenteric and the para-aortic adenopathy. What are the treatment options we have? Just like the other types of plasma cell dyscrasias, the major treatment options which we have are the chemotherapy. Chemotherapy with novel agents, newer immunological agents like the fludarabine or cytarabine or bomacetine. These are the drugs which we used in various combinations, looking at what suits a certain type of a patient. Along with that, for the infections, we can give the patient certain novel antibiotics. For the malabsorption, we can do the symptomatic treatment, the diarrhea treatment. We have to replace the fluid. We have to look at the weight loss of the patient. And then we have to look at the overall picture. What are the major symptoms being affected? And so the therapy is basically just like the other types of rare plasma cell disorders. It is a symptomatic therapy rather than a curative therapy. The curative therapy options are generally not available for these rare disorders. So with that, we complete our discussion of the rare types of the plasma cell disorders. We started off by talking about what are the plasma cell disorders, how do we define them, what are the major clinical features present in them, what are the etiological classification, what are the major subtypes, the most common ones being the multiple myeloma and the other rare subtypes. Then we talked about the immunology and genetics, how with the help of a VDG and the VDJ and the VJ recombination, that leading to the antibody production, and what are the steps that can go wrong leading to this problem. Afterwards, then we discussed all the individual rare entities, the Waldenstrom macroglobulinemia, the heavy chain diseases, and the other subtypes in slight details, concentrating on what are the various clinical presentations that separates one entity from the other. In the next lecture, we are going to talk about multiple myeloma in detail, and that will be a complete lecture dedicated to that disorder because it is the most common type of plasma cell disorder, and it is the one which you are more likely to see on the examination and also in your clinical practice. I hope you have learned something new. Thank you for watching sqadia.com.